Hi, everybody. My name is Joyce Patterson. I'm a nutrition consultant with HGM Management and Technology, and it is my pleasure to welcome you today to the second session of this webinar series. Today, we're going to be talking about using consumer-tested nutrition messages to design motivational resources for your target audience. Before we proceed, I would just like to recap some of the highlights from the first session of this series. And if you were unable to attend that first session, you can view the recorded video at the www.nutrition.gov. And a lot of the information that we present today does build upon the information that we presented in the first session. So we do encourage you to view that video when you get a chance. Okay, so just to recap from last time, the USDA Food and Nutrition Services and their partners, there are several partners that listed here on the screen, along with a work group that consisted of nutrition educators and nutritionists and communication specialists. They worked together with the objective of developing nutrition messages and supporting content specifically for moms and kids who participate in nutrition assistance programs. And the purpose of these messages is to communicate the dietary guidelines for Americans and MyPlate in ways that are easy to understand and relevant and motivating for this specific audience. It was a very collaborative process where the partners and work group met periodically to provide input throughout the development process, and it was a very highly audience-focused approach as well, where we had conducted several rounds of focus groups around the country, not only so we could get to know our audience better, but also to test the concepts and the content that we are developing to make sure that these materials truly are resonating for this specific audience. So some of the key findings from our research was that for moms, fruits and veggies are still top of mind when it comes to healthy eating, but we also found that many still serve 2% or whole milk to their families, as many of them, one of the reasons being that many of them perceive low-fat or skim milk to be diluted and watered down and perhaps may not provide the same nutrients that whole milk provides. We also learned that there continues to be a lot of confusion about whole grains as far as how to identify whole grains, which foods are whole grains, and what the health benefits of whole grains actually are. And among the preschool moms, many are still not comfortable with the idea of letting their children choose which foods to eat or how much to eat or whether or not to eat. And, as we know from the literature that giving children more responsibility in the decision-making process in eating can help them to develop good eating habits. And finally, from our focus groups, all of the moms had reported regular access and use of computers and the Internet, and as well as many of them did have cell phones with Internet access. So the final products included 29 messages that focus on child feeding, whole grains, milk, and fruits and vegetables. And there are some messages specifically for mothers of preschoolers, some specific for mothers of elementary school kids, and some of the messages are appropriate for both groups. And there are also messages for kids age 8 to 10. And in addition to the messages, there are about 35 pages of tips, advice, recipes, guidance, and tested photos to help support these messages. We also developed ready-to-use online communication tools, and later in the session we're going to be looking at one of those in more depth. And also for kids, there is a video game and activity sheets available. And for you, there's also an implementation guide available to help guide you in incorporating these resources into your educational programming. So yes, there are a lot of resources available, and these can be applied in a variety of ways, from online and social media to traditional print to counseling and group education. And later during this session, we're going to hear from our speakers who will share examples of how they've used these materials in their work. And we are looking forward to hearing from them. And so by the end of this webinar, we hope that you'll have a better understanding of the benefits of using these consumer-tested resources, as well as the key steps involved in developing a nutrition education tool. And you'll also see how others have used these resources, and so we hope that that will help provide inspiration for you as you plan development of your next education tool. And for some of you, you'll be earning some additional CPE credit by developing a new tool or refining an existing tool that you have and incorporating the core messages. And you'll be submitting that to us for feedback from us to help you finalize that tool. So we have an experienced group of speakers today, all of whom have had hands-on experience in using these resources and in working with this audience. Our first speaker today will be Judy Wilson, Senior Nutrition Advisor at the USDA Food and Nutrition Service, followed by Alicia White, Senior Nutritionist in Child Nutrition at FNS, and Dr. Glenda Kanaka from the University of New Mexico Prevention Research Center, and Danielle Quigley of the SNAP-Ed Just Say Yes to Fruits and Vegetables program in New York. So now I will hand it over to Judy, who will talk to us about using these resources in creating inspiring nutrition education tools.
Again, thanks, Joyce, for that excellent overview of what was covered last September. As many of you know, we had to reschedule this webinar from October to January. So I thank all of you who have come back, and we also welcome those of you who are attending for the first time. You know, this is a very exciting time, I think, for nutrition educators. The advances in science and technology and the wide access to the Internet provide opportunities for us to reach our audiences in multiple ways and through many different types of channels and venues. The lower cost of computers and our color printers and even color ink and other devices that are connecting people around the world makes it possible for us to customize our tools and to increase the personal relevance. And this is even more feasible than it ever has been in the past. Online images are accessible and affordable, and more, now there are images that are appropriate for low-income groups, making it even easier for all of us to create simple but effective tools and to tailor them to our audiences. As George said earlier, many low-income households have access to the Internet, and this gap will continue to decrease. Many use it for health information. For example, the Pew Foundation estimates that 25% of Internet users have watched an online video about health or medical issues, and I know that many of you have as well because I recently did so myself. Among low-income groups, they are spending even more time on social media than higher income groups, 87.5% versus versus 39.8 minutes. That's a lot of opportunity for all of us. And this suggests that social media is a viable channel for reaching our audiences. But mothers still like more traditional ways of getting their information out. So a communication approach that uses a variety of methods and channels has a better chance of getting to our people not one time but multiple times and for being more effective because of that. Now, if you're planning a broad-based communication or social marketing campaign, the NIH NCI, and that's the National Cancer Institute guidebook, which is commonly known as the Pink Book, and it has been around for many years and undergone several revisions, is an excellent resource. As shown on the side, it uses a cycle that can be very useful when developing materials, as well as for planning larger interventions, but you may not need to use all of them. The Pink Book also provides information and guidance about theories and models. Theories and models can help you to determine whether a specific idea will work. And many of you are already familiar with using the stages of change model shown here and others as well. But I wanted to also show you this chart, which provides 3 other theories that are widely used in health communication. And it also shows the levels to which they generally apply. Now, Joyce alluded to this earlier, but the approach that we used in developing the core messages is based on the social marketing framework. But we also used aspects from other models as well. And the Pink Book says that this is a good way of addressing many of the problems. Whether you are creating a simple brochure, a web page, or an interactive tool, the steps shown here can help you to create a more effective tool. The main advantage of using the core messages is that some of the work has already been done, as indicated by these checklists. Now, you will still need to do additional work, such as to segment your audience further, to gather information that may be unique to them, and to define your behavior goals. But a lot of the heavy lifting has already been done. So let's take a quick look at how to use these different steps. The messages we're discussing today were designed for low-income moms with children 2 to 10 years of age that are eligible for or participating in one or more of the food assistance programs. The women in our research were English-speaking, white, Black, and Hispanic moms who were very acculturated to the American diet and society. Most of them had 2 or more kids, had a high school education or higher, were married, and about half of them were married or divorced and working either full-time or part-time. If you plan to use the messages with an audience that is different in a major way from these moms, you will need to do more extensive research and testing to ensure that the strategies are appropriate and that the wording is clear, appealing, and inspiring to them. Now, the messages focus on 4 behaviors. If your goals align with these, the core messages are appropriate for you. The child feeding messages for moms of preschoolers focus on healthy eating practices such as mothers eat and prepare foods with their 2 to 5-year-old kids more often. They serve as good role models for healthy eating. They allow their 2 to 5-year-olds to make food choices about how much, whether, and when they're full, etc. Now, the messages regarding fruits and vegetables, whole grain, and milk are for both groups. And as shown on this slide, we have 24 messages that are specifically for moms. 15 are for moms of preschoolers only, 6 are for moms for elementary school only, and 3 work well with both groups. Now, some of those 15 might work with older mothers, but if you want to do that, you would need to do more extensive testing. So before you get started, review all of the message and become familiar with them. It's very important. The messages are organized by topic and type. They align with and support the Dietary Guidelines for Americans and My Plate. So after you look at them, select one or two messages that align best with the behavior you want to achieve. Get input from a few of your clients and maybe even your partners or your colleagues to ascertain which one of those do the best job of getting the key points across and would be motivating to the mothers to take action. If you plan to use photos, include them to ensure that there's nothing offensive and that the photos amplify the desired behaviors. When deciding on format and channels, consider using a variety of approaches since no one tool or channel will work for everyone. And select the format that works best for most of your audience as your primary resource, and then add others that will play a supporting role depending on your funding and as you get more of it. In terms of channels, you should think about how your audience will find and receive and experience the material. Now, most of you that are participating in the offline component indicated that you are developing a brochure or other printed materials. But keep in mind that there are lots of quick and easy ways you can use the messages too to reinforce your overall efforts. For example, the short ones can be used in the in Twitter messages, for example, and you can insert them as well into your recipe sheets or books if you are developing them to inspire mothers to try the recipes. Once you've decided on your audience, the behavior objective, the message, and the format and channels, you're ready to develop the content and draft your tool. Now, we have the 35 pages of supporting content, and they include mom-to-mom stories, bulleted tips, ideas, Q&As, interactive sheets, and more. And most of it is written at the 5th grade level or lower for easy reading and clarity. And, you know, while we are writing for low-income audiences, I think all audiences will appreciate the ease with which these materials are communicated and how clear they are. So I wouldn't be shy about using them with others. As shown here, each page of supporting content has the message at the top that aligns more closely with it. That said, much of the content can be used across the topic. So much of the content for this message might fit with another of the child feeding messages, for example. So review all of the content and select the part of it that works better with your behavior goals. Identify chunks of information that you think is pertinent. You may have to, and probably will need to, cut that down later, and then organize it in a logical flow. I also recommend that you include different types of information, i.e. tips with a narrative or recipes, and always, if you can, include something to make it engaging and interactive. The content that we have here provides the benefits of the what, the why, the how, and even some inspiration. By combining a message with selected parts of the supported content, you can quickly create articles for newsletters, for moms, for schools, and community groups. This one took about an hour and a half for me to do, including selecting the format that I like from Word and finding the content and message that I wanted. And then I spent another half hour sort of playing around with where to put things. All of the information that is here came from the content on the previous page that I showed you. The two sentences that are in yellow here are the only content that I added. But the content in this area, I did reorganize it for a better flow, and I took this content from another message, feeding their independence at mealtime, to introduce this section. And the interactive component is that they decide what they're going to do. And just one quick additional example is the fact sheet, but I won't spend much time on it. I want you to see it for the white space and for, again, the message, the key message at the top. The final point that I want to quickly talk about is the importance of getting feedback, not only from moms, but also from your partners and from your colleagues that will be helping you to disseminate and get the item where you want it to be. And get feedback from both moms and partners, and do it often and do it early. When talking to moms, probe for their understanding about the what, why, and how. Get information about what they like more and less, and whether there's anything that is offensive to them. Ask about what advice they might give a friend from what they have read. And when possible, test the material where they are going to be using it. You may test with individuals or in group and use both, either or both informal and informal methods to do so. The number of people that you include depend on the product, but plan on 20 to 50, less if it's short and simple, more if it's more complex. Now let's look at developing the rollover, a case study. You'll see here that the first two steps are already checked off because we had identified our audience and done our research. In the first round of testing, we got information from moms on their information-seeking practices, such as where they go to get information about health and how they like to get it, in what format, their accessibility to the Internet and their cell phones as well. We found that all mothers had regular access to the Internet, and Joyce has already covered that. And you could see in this area what some of the key sources of information that they looked at. So this indicated to us that the Internet was a viable channel for reaching our moms, so we tested these three concepts. And from the testing, we determined that, that mothers really like different aspects of these tools, but none of the tools, or neither of the tools, quite did the job as well as we wanted. With the rollover or the widget, mothers like the simple format, the easy-to-use format, but they reported that they wouldn't click on something that looked like an ad. And they didn't like the fact that they would have to click in order to go to the next tip, because they feared that they will get spam or other information that they really did not want to get. Feedback on the rollover was generally very good. It was non-intrusive. It didn't require them to click because the information would appear as they were rolling over the picture. And they liked this aspect that was a scavenger hunt type feature because they thought that was fun. But they were concerned that the mothers wouldn't just intuitively know to click on the picture. So we addressed their feedback by creating a rollover widget which combined the best of both of those tools. When the mouse rolls over the pictures at the bottom that you see here, they get a different message. Mothers wanted us to include more images of kids, and we did that. We have more cute kids. And this tool also addresses the what, when, and why. So we addressed most of the concern, but still, before we finalized the tool, we got additional feedback from our partners, and we also got feedback from 9 additional moms to make sure that the tool was doing the job that we wanted it to. And while your message and content are important, a great design can pull the audience to your product. And I just wanted to point out a few of the design features that you might want to keep, in the back of your mind as you think about your materials that you're developing. For example, the placement of this very emotionally appealing photo to catch the audience attention and guide the reader to this message. You got the whole grain, and it just guides them there. People read left to right, and the flow of the material is left to right. There is a generous white space. It's not crowded. We included the instructions here, and we use the rule of three. No more than 3 fonts and no more than 3 accents to prevent the people from looking too busy. To make the reading easier, you'll notice that there are no italics on the tools. So now let's work together and do a interactive exercise where we develop a tool ourselves. So let's do that. Now, this slide summarizes again the steps, and I have the check marks there again because we've already made those decisions. We're going to do the tool for a English-speaking mother of preschoolers. We're using the research that was done for the core messages to do this, and because we need to keep it simple, the format will be a bookmark, and the distribution channel will include community partners and sites such as libraries. Many of you identify whole grains as your topic that you're going to be developing materials for. So the behavior is moms and kids consume the recommended amount of whole grains on most days. So keeping this in mind, let's look at what the objective the message might be. Now take a look at these two. The first one is on whole grains make a difference, and the second one, start them early with whole grains. If you prefer the first message, click on the raised hand in the upper right-hand corner of the board to show that you like that message best. All right, so I'm seeing some people clicking it. Fabulous. So now, looking at the second message, those of you who like that one best, go ahead and click on it too. Whoa. Well, it's clear that most of you want the message, start them early with whole grains. So that's the message that we will be using. Now, the bookmark is a very simple tool that really serves to reinforce your larger educational initiative. So it should complement and reinforce the major message and your goal. So you should consider what would work best with that message we have selected, start them early with whole grain. Now look at the supporting content here, and if you think that how to tell if it's a whole grain does the best job of supporting that message, go ahead and click on the raised hand now. All right. A lot of you think that does a great job. All right. I'm going to clear those raised hands, and I'm going to ask those of you who think that the second set of supporting content, Hidden Whole Grains into Your Preschool a Day, does the best job. Go ahead and click now. Oh, gee, it is very clear that the majority of you think that Hidden Whole Grains into Your Preschool a Day does the best job. So now let's take a minute to just review the product, what that would look like with that particular content. Okay. Is this bookmark ready for public use? Is it clear what the tool is about? Is it visually appealing? Does it contain the content that provides the what, why, and how? Is it engaging? Is there an interactive component? Is it easy to read? Does the visual reinforce the desired behaviors? If you think it does, go ahead and click. If you think it's ready to give out to people, go ahead and click. Well, a lot of people think it's ready, and whether you think it's ready or you don't think it's ready, you're right, because it is ready, but it's ready. What it's ready for is for testing with your target audience and for getting more input from your partners. The consumer testing and partner feedback are really critical. The partners, if you get them involved early and get their input and they feel some ownership, they will be even more willing to help you to distribute it to the moms. And some of them might even do more. They might want to reprint it themselves or customize the tool for Spanish-speaking audiences, for example. So that wraps up my part of the presentation. But feel free to explore use of this tool. But remember, before you do so, test it and refine it with your audience and your partners first. Now it's my pleasure to turn it over to Alicia White, who will share some of the ways they're using the core nutrition messages in teen nutrition. Alicia?
Good afternoon, everyone. I'm thrilled to have the chance to tell you about how the FNS core messages are being used in teen nutrition resources and materials. For those of you that aren't already aware, Teen Nutrition is an initiative of the Department of Agriculture's Food and Nutrition Service that supports the child nutrition programs through a number of behavior-oriented strategies. One of the ways in which is the provision of multifaceted integrated nutrition education for children and their caregivers. This education is designed to build skills and motivation for children to make healthy food and physical activity choices as part of a healthy lifestyle. So through Teen Nutrition, schools today have access to many free nutrition education materials, including classroom lesson plans, posters, music, parent handouts, and computer games. These nutrition education materials rely extensively on audience-tested messages to ensure that they're clear, relevant, and motivational. So now I'm happy to go through some of the ways in which Teen Nutrition has used the audience-tested FNS core messages in our materials. We have used the whole grains and milk messages and tips in our parent handouts, including this My Plate at Home parent handout, which accompanies the Serving Up My Plate curriculum for elementary schools. As you can see here, we paired the strength of the written message with reinforcing images. So we did further focus group test this handout since we were incorporating new images in conjunction with the FNS core messages. In this Serving Up My Plate lesson for 5th and 6th grade, we've used the track and field game, also developed under the Core Message Project, to help reinforce learning. In this lesson, which focuses on why it's important to eat a variety of foods from all the food groups, the track and field game helps reinforce this concept in a fun and interactive way by having children answer nutrition questions as they compete in the javelin, high jump, long jump, and dash. In addition, Teen Nutrition has also extensively used the Eat Smart to play hard messages in a number of ways, from posters to these free downloadable graphics that schools can incorporate on their school lunch and breakfast menus. Teen Nutrition's Dig In lessons engage 5th and 6th graders in growing, harvesting, tasting, and learning about fruits and vegetables. The FNS core message supporting content related to fruits and vegetables has been incorporated into Dig In at Home, which is a beautiful color booklet for parents. This publication was also further focus group tested with parents during its development, since we have paired the FNS core messages as well as other supporting content that matches the curriculum for what children are learning about in school. This spring, Teen Nutrition will release a popular events idea booklet that provides elementary and middle schools with ideas and supporting resources for school-wide events that promote nutrition and physical activity. As part of this resource, Teen Nutrition has further designed and formatted the FNS Core Message Kids Activity Sheets for use as ready-to-go handouts in conjunction with these certain events. So these are all just a few of the many ways Teen Nutrition has put the FNS core messages into action, and I encourage you to stop by teennutrition.usda.gov to see our many evidence-based materials and resources. All of our materials are downloadable for free, and free print materials are available to schools and child care that participate in the federal child nutrition program, such as the National School Lunch Program. So I thank you for your time and look forward to receiving your questions. I am now going to turn the presentation over to Glenda.
So the New Mexico SNAP-Ed social marketing project started a few years ago when the state agency wanted to use the FNS core nutrition messages to be consistent among programs and implemented agencies. Because of the big Spanish-speaking population in New Mexico, materials needed to be in Spanish. So knowing all the work that had gone into developing the messages and all the research and also following the guidance from Maximizing the Message, they decided that a simple translation of the materials wouldn't suffice, but that some research needed to be done. So that is how the partnership between SNAP-Ed New Mexico and the University of New Mexico Prevention Research Center started. During the first semester of 2013, New Mexico piloted the first social marketing campaign on fruits and vegetables and low-fat dairy using the FNS core nutrition messages. The target audiences were low-income, Spanish-speaking mothers of preschool-age children, mothers of school-age children, and children ages 8 to 10. The venues chosen were the Head Start, the elementary school, and the grocery store in the community. So we developed banners, posters, and videos with the messages. This was phase 3 of the project, the result of a couple of years working really hard and learning from our experts, the audience. It was hard work and challenging, and what helped us so much was that we were following very closely the work done by FNS. We were applying the work to a very specific audience, but following a general framework. So the team went through the steps that Judy described. In phase 1, we conducted focus groups to get to know the audience. We exposed participants to the core concepts and explored delivery methods. On phase 2, participants were presented with the core messages and supporting content in Spanish and got the opportunity to give their feedback about the use of specific words in Spanish and if the messages resonated to them. And again, they got the opportunity to design a campaign that would work for them. In phase 3, we developed the materials, pre-test them, and then implemented the campaign. The big 2 topics that we wanted to concentrate first were fruits and vegetables and low-fat dairy. We already had the feedback from the focus groups that they like videos as one way to deliver messages. So we embarked in creating a video in Spanish, similar to the FNS video on milk, and one brand new on fruits and vegetables. Well, anyone that has developed a video knows how hard it is, so we had to find the actual person that was going to connect with mothers, the right location, images, so many details. But the important piece was already there. We used the messages and supporting content that FNS had already tested and that we had tested during phases 1 and 2 with our audience. We didn't have to create anything. All the stories from moms were there, reflecting their barriers. There were practical tips, and what we already knew from our testing, it had the motivation. These are some of the shots of the video. It follows as much as possible the style of other FNS videos. A mother talking, telling her story, her experience. We added the 2 messages that were chosen by the audience and gave concrete examples of the desired behavior. We cannot emphasize enough the importance of pre-testing with the intended audience, as Judy already mentioned. Since we were piloting the campaigns and studying the feasibility to implement as part of other nutrition programs, we had reinforcement activities with the 3 intended audiences. As part of our family events at the elementary school, mothers would look at the video in their own language and as a group discuss them. In those groups, they were asked to write down their thoughts about the video. In this slide, you can see some of their responses. They loved the tip about dipping apple in pineapple juice, and we already knew that from the formative research focus groups. They've told us that. So in the final video, we show the whole process of dipping apples into pineapple juice. When we pre-tested the video and also during the implementation of the campaign, moms told us they liked it very much. As part of our process evaluation, we gave participants an evaluation form and asked them to tell us what they learned, if the activities had convinced them about making changes, and what were those changes. Many of our programs are working towards the same goals, increasing fruits and vegetables, low-fat dairy, whole grains. The goal of our project is to use the same messages across the programs to be consistent, to maximize our messages. We are developing a toolkit to make it accessible to anybody. There will be a user-friendly website that people can access and get the posters, add their logo and contact information, and send it to the printer to create posters, banners, billboards. A consistent campaign across the country, already tested, ready to go. Now, Danielle will tell us about New York's Just Say Yes to Fruits and Vegetables project. Danielle?
Thank you, and good afternoon, everyone. I'm thrilled to share some of the work that New York State has done to promote and utilize the FNS messages through online uses. First, I'll start by sharing a little history about the Just Say Yes to Fruits and Vegetables program, also referred to as JSY. JSY provides nutrition education programs to low-income, SNAP-eligible families with the intent of increasing fruit and vegetable consumption, preventing overweight and obesity, and reducing the risk of chronic disease. JSY provides direct nutrition education through classes held at food pantries, shelters, soup kitchens, and farmers markets, and also indirect nutrition education through its website. At the time that Phase 1 FNS messages were released, the JSY program was undergoing a major transformation with their website and curriculum. As a program, we really wanted to do more to empower families to eat healthier. And additionally, our state health department was working to create unified messaging among all nutrition and food assistance programs, like the Child and Adult Care Food Program, WIC, and the Hunger Prevention Nutrition Assistance Program. And we found that the FNS messages were directly applicable to our work in terms of obesity prevention, working toward increasing fruit and vegetable consumption, and encouraging healthier child feeding practices. So for JSY, we identified 3 key areas to promote the messages. First, sprinkled throughout our website, and I'll show you some of those graphics in the next slide, through podcast messages on the website, and also used as part of our curriculum. So at this time, I'd like to play a short 1-minute podcast message for you, and this one promotes good role modeling.
If you're like me, you want to set your kids up for a healthy future. I realized if I wanted to teach my kids to eat more fruits and veggies, then I needed to set a good example. As a busy mom, do you have a hard time eating fruits and veggies? Let me share some tips with you that help me eat more fruits and veggies and help my family eat more too. Stir thawed frozen berries into yogurt for an energy-packed breakfast for yourself and for your family. Pack cut-up veggies like baby carrots, celery sticks, and green pepper strips for your own lunch, and let your kids know what mommy will be eating at work. Bring fruit along for a snack on the run for your kids and yourself. Lots of fruits are easy to take with you, like bananas, apples, and oranges. Serve canned beans as a main dish or as a side dish for dinner. They're delicious and so quick and easy to serve. And rinsing canned beans in cold water makes them lower in salt. And when you eat dinner together with your children, try to make sure that half your plate is veggies. Make fruits and veggies a part of every day for your family and yourself. Let your children see you enjoying fruits and vegetables at meals and snacks. They take their lead from you. Eat fruits and veggies, and your kids will too.
So we have a total of 4 podcast messages sprinkled throughout the website that support the following FNS themes: produce pickers, making fruits and vegetables available, division of responsibility, and as we just heard, role modeling. Here are a few examples of what you'd find on JSY's website. These photos were taken from USDA's SNAP-Ed Connection website and also from the New York State WIC program. Some examples include Cook Together, Eat Together, Talk Together, Eat Smart to Play Hard, Let Your Kids Be Produce Pickers, and one of my all-time favorites, They Learn from Watching You, Eat Fruits and Veggies, and Your Kids Will Too. So in 2012, it's estimated that 54,000 individuals were exposed to the FNS messages through the website and also nutrition education classes. And for the coming year, we'd also like to incorporate the YouTube videos and the rollover widgets as well. Our program really values these messages. They're positive, action-oriented, they're short, simple, and easy to understand. We have a very high comfort knowing that the messages have been tested and accepted among our target population. And most importantly, they directly support JSY's vision of empowering families healthier and increased consumption of fruits and vegetables. I'd like to thank you for your time, and I'll turn this over to Joyce now for questions.
Okay, so we have time for a few questions now. So I am going to read one that we received for Alicia. Are the printed materials available at Team Nutrition for WIC agencies as well?
Hi, thanks, Joyce. Well, all of our materials are available in an online format and can be downloaded and reproduced by anyone. The printed materials that can be requested can only be requested by those entities participating in one of the federal child nutrition programs, which would be the National School Lunch Program, School Breakfast Program, Child and Adult Care Feeding Program. So that is not just WIC in and of itself. But you can go to the website and download and reproduce any of our materials.
Okay, great. Thank you. Let's see. I have a message for Danielle. Could you please describe what kind of focus group testing was done in the development or assessment of the JSY podcast?
Sure. So where we had done focus group testing was actually in the development of the website itself. What we wanted to do was get an idea of what information participants wanted from the JSY website, and what we found was that the great majority were really looking for healthy recipe ideas and recipes that could be divided into several major categories, such as breakfast, lunch, and dinner recipes, snack ideas, 30-minute meal ideas. And so where we had spent the majority of our time with focus group testing was really with the layout and the content of the website, and not so much with the focus group testing of the messages themselves, because USDA had done focus group testing.
Okay, great. All right, so I have a message that anybody can answer here. These messages were mostly geared towards promoting what to eat, but what about messages promoting about what not to eat? Which is more important? Anyone?
Generally, positive messages are more effective, and that is why we chose to promote the foods to increase. That also aligns with the dietary guidelines, and the foods that we are talking about are those that the dietary guideline also is recommending that people eat more of. Alicia, did you want to add anything to that?
No, I mean, I agree, and generally we try to use the promotion of positive messages, especially in our messages geared toward children. We do have information, though, in activities included in our curricula and other resources, including that My Plate at Home, which encourages, and provides guidance about choosing drinks with fewer added sugars and that kind of thing, but they're not considered FNS core messages per se.
Right. And I think that what we do is tell them what not to do in a more subliminal way. For example, choosing fruits and vegetables packed in water or that are low sodium, rather than saying don't buy foods that have a high sugar content or a high sodium content is another way of saying what not to do, but saying it in a positive way.
Okay, we've gotten a couple questions, Judy and Danielle, questions about Spanish translation. Danielle, is your podcast going to be available in Spanish?
At this time, we don't have a podcast in Spanish, but I think it's a great idea and something that our program should work towards.
And that's a great question for me. It's because I forgot to say that we have completed the Spanish translation of all of the core messages, and we expect to be releasing those shortly. So, and more immediately, keep in mind that Glenda has done translations as well, and those materials might be available and accessible. Glenda, are they? Can people download those from your site?
They're definitely available already. The videos, so we have the Spanish video for fruits and vegetables and milk, and we have also the posters. I would encourage at this point people to contact me directly, and I can tell them more specific because we're still testing more and more. We're developing whole grains. Some people have individually asked me, and I send them my contact information, but I will write it down for everybody right now. Contact me. They're definitely available, and will be a joy if some more Spanish-speaking people can access these.
Okay, great. We have a couple minutes more for questions here. So there's one here that says, was any WIC program used to help in testing or measurement of value from any of these messages?
WIC participants probably represented a third of the moms that were in the focus group. And the good news for those who work with WIC out in the field is that from 2008, when we did our first round of focus groups, to the second round of focus groups that we did in 2010-11, the WIC participants that were in those groups had really changed their perspective, particularly related to the division of feeding responsibilities, and more of the moms in WIC were really accepting of those tenets in the latter group than they were in the first group. So that was such encouraging news, and the staff, some of the staff from WIC were at those from headquarters were at those focus groups, and they got to hear that. And so clearly you're doing a lot of good work out there, and people are getting your messages.
Okay, great. And we have time for just one more, and we've got a number of questions about, Judy, when people can expect to access the slides and where they'll be available.
Much quicker than the first time. We're going to try to get the slides up on the website, on the Core Message website, very quickly. Our goal is maybe by Tuesday, Wednesday next week, we can have those, but certainly within a week, the slides will be available. The video may take a little bit longer, and it will be up on the nutrition.gov website. Probably, Mimi, what would you say, within a week? But in any event, we will let you know when it's available. Within your email.
Yes, absolutely. Okay, great. Thank you, Judy. It is about time for us to start wrapping up. Thank you for all your great questions. But just to summarize today, we were able to illustrate some of the key steps involved in creating educational tools, and we emphasize the importance of audience research, content development, and getting feedback from audience and partners. And we also discussed the key content to include in your tools, including the what, the why, and the how, as well as the importance of making your tools engaging and even including an interactive component to help the audience retain the information and increase the likelihood that they will actually take action. We also provided some design tips as well as some additional references to help guide you in developing your tool. Unfortunately, we couldn't go too in-depth in just this 1 hour, but do remember that less is more. And finally, we saw some great examples from the field, and a big, big thank you to Alicia, Glenda, and Danielle for showing us just how endless the possibilities can be. So thanks so much to our speakers, but thanks especially to all of you for joining us today. The next step will be for those of you who are registered for the offline activity. You can now take the information that you've gotten from these sessions to refine the tool you're working on and submit a draft to us by January 24th. And you can expect to receive some feedback from us within a few weeks, and we hope that you will be able to apply that feedback and eventually finalize your tool and use it in your practice. And the implementation guide is currently being updated as well to include all these great new materials, and we'll be emailing a link out to all of you to this implementation guide as soon as it is ready. And the same thing goes for the Spanish translation that Judy had mentioned. As soon as that is ready, we will be emailing those out to you as well. And I just wanted to share with you the website address where you can download all of these messages and content and photos. And if you do apply them in your work, we would love to see what you're doing with them. So please absolutely share your work with us and email them to us at this email address shown here at the bottom of the screen. We look forward to seeing that. And finally, here is a list of resources just to provide you with more information to further help you as you develop your educational tools. And before we go, I just wanted to pass it back over to Judy.
Friend Joyce, and thanking all of you for joining us again. And I wish you well in your efforts to reach and improve the eating habits of those we serve. You do great work, and it's very much needed, and it's very much appreciated by all of us here at headquarters at the Food and Nutrition Service, USDA. So thank you so much.